Before we get to this video clip on Bernie Sanders on universal healthcare, let's go over the key points that progressives stand for on this matter. Progressives emphasize that healthcare should be accessible to all Americans, regardless of their financial situation. They argue that a single-payer system would eliminate financial barriers to healthcare and ensure that everyone receives the medical attention they need. Progressives contend that a Medicare for all system would ultimately save money by streamlining administrative costs and negotiating lower prices for prescription drugs and medical services. They often point to the high administrative costs of the current multi-payer system and the excessive profits of insurance companies as areas where savings could be achieved. Now, off to this wonderful clip of Bernie Sanders, and following a wrap-up of other key points of universal healthcare.
We are all aware of the enormous crises facing our country and the world. We see the horrific war and suffering in Ukraine. We're more than aware of what the scientists are telling us about climate change and the existential challenge that it poses to the planet. We are mindful of the current pandemic, which has already taken almost 1 million lives in our country, and the likelihood of future pandemics. We are outraged by the massive level of income and wealth inequality in America, the fact that half of our people live paycheck to paycheck and struggle every day to provide for their families at exactly the same time as the very wealthiest people in this country become richer, and we move toward an oligarchic form of society. And in the midst of all of that, Donald Trump and his allies are moving aggressively to undermine the very foundations of American democracy. But in the midst of all of that, and that's a whole lot, it is imperative that we not lose sight of the healthcare crisis which exists in our country and what that means to ordinary Americans. Today, the United States remains the only major country on earth not to guarantee health care to all people as a human right. The result of that is that over 80 million Americans are uninsured or underinsured with large deductibles and copayments. In America today, we spend far more per capita on health care than any other nation, almost $11,000 per person, while at the same time some 60,000 Americans die every single year because they lack insurance and are unable to get to a doctor on time. In America today, we pay by far the highest prices in the world for prescription drugs. In some cases, as much as 10 times higher for the same exact drug as sold in Canada or in Europe. The result of that is that 1 out of 5 patients in our country are unable to fill the prescriptions their doctors prescribe, and many become unnecessarily sicker and sometimes even die as a result of not getting the medicine they need. In America today, we have a major shortage of doctors, nurses, and other healthcare professionals. The result in many parts of this country, especially rural areas, it is increasingly difficult for people to receive the medical attention they need in a timely manner. Meanwhile, in the midst of this doctor and nurse shortage, young people are leaving medical school and nursing school hundreds of thousands of dollars in debt. Dental care in this country is outrageously expensive, and millions of Americans, including many seniors, do not get the dental care they desperately need. A significant number of dentists do not accept Medicaid payment, which means that lower-income Americans cannot get to see a dentist, even when they're in pain. At a time when over 100,000 Americans died last year as a result of drug overdoses, it is clear that we are looking at the worst mental health crisis in the history of our country, and we have barely begun to address it. And these are just some of the crises facing our dysfunctional healthcare system. In my view, and I have said this for years, healthcare is a human right and not a privilege. Simply stated, that means that every man, woman, and child in our country should be able to receive the best possible medical care available, regardless of their income. That means that when you're sick or you're in need of an annual checkup, You should be able to walk into the doctor's office of your choice and get the care you need. No forms to fill out, no deductibles, no co-payments, no bureaucracy, just you and your medical provider. There should also be a much greater emphasis on disease prevention, keeping us healthy rather than just treating us when we're sick. Let us be very clear. None of this will happen so long as our healthcare system is controlled by private insurance companies. That is the simple truth. The function of private insurance is not to provide quality care for all, but to make as much money as they can for their stockholders and to pay their CEOs outrageous compensation packages. That is why we need to move to a Medicare for all single-payer program. But as I think you understand, taking on the giant insurance companies, their lobbyists, their apologists in Congress, and the fear-mongering we face from the corporate media will not be easy. Just as one example, the pharmaceutical industry itself, just the drug companies, spent some $300 million in lobbying to make sure that Congress did not lower the outrageous cost of prescription drugs in this country. They had over 1,500 paid lobbyists on their payroll, 3 lobbyists for every member of Congress to protect their interest. And that's just the pharmaceutical industry. But the good news is, despite all of that, is that in recent years, more and more Americans have come to understand that the current healthcare system does not work for them and needs to be fundamentally changed. The pandemic, in which millions of workers lost their employee-based health care through no fault of their own, made the absurdity and the irrationality of the current system even clearer. And the increased support we are seeing for Medicare for All is coming not only from healthcare consumers, not only from ordinary people, but is coming from doctors and nurses and healthcare professionals all across the board. These healthcare practitioners want to be able to practice in a system that is designed to protect human health, not protect corporate profits. This Tuesday, my progressive colleagues in the House will be holding a hearing on Medicare for All, and I applaud them for doing that. In early May, as chairman of the Budget Committee, I will be holding a similar hearing, and we will be discussing on the committee the findings of the Congressional Budget Office, which determined that Medicare for All would not only provide coverage for every American as a right, but would save the healthcare system in our country hundreds of billions of dollars. This struggle for a healthcare system that guarantees care to all will no doubt be difficult. We are taking on some of the most powerful special interests in the world. But it is a struggle that must be fought, and together it is a struggle that we will win. Thank you very much.
Progressives believe that universal healthcare would lead to better health outcomes for Americans overall. By providing preventative care and early treatment, he argues that the incidence of chronic diseases could be reduced, ultimately lowering healthcare costs and improving quality of life. Progressives highlight how universal healthcare could help address health disparities that disproportionately affect marginalized communities. Progressives see it as a way to ensure that everyone, regardless of race, ethnicity, or socioeconomic status, has equal access to healthcare services. Progressives' approach to universal healthcare often involves a phase-out of private health insurance. Progressives argue that private insurers prioritize profits over patient care and that a single-payer system would be more efficient and equitable. Well, I hope you like the video and give the channel a subscribe. Now, take care and bye-bye.